Welcome to Ascend Growth AI podcast, where we mix smart growth moves with a little AI magic. I'm Nikki. Let's dive in. For today's guest, we have Serhii Zatsarynin, who is the CEO and founder of Ovul. He is an innovative leader in women's health, a problem solver at heart, and someone who has turned a deeply personal challenge faced by millions of women into a powerful AI-driven solution. Serhii took something that is often confusing, stressful, and filled with uncertainty, understanding hormone patterns and ovulation, and transformed it into a clear, accessible, at-home experience powered by smart technology. Today, we are going to explore his journey, how it works, who it serves, and the industry shifts that are redefining women's health. We'll dig into what's working, what's been challenging, where the company is headed next, and how AI is shaping their future. This is going to be insightful, inspiring, and packed with value. So let's jump in. Can you share your journey into women's health and what made you create this product?
Sure. So, I cannot basically say that Ovo is something outside of how I started and what I'm building. Everything is connected into one story. You know that sometimes it's hard for families to have kids, and this is something that I faced, and I'm very lucky to say when we were trying for our third child. I appeared, before I knew almost nothing about ovulation, very little information. But with the third kid, when we were trying, I feared that we need to test ovulation and hormones daily. And at that moment, I was leading Siemens Healthineers, one of the top diagnostics companies in the world. I was building the huge labs with super top-notch diagnostic solution. And at home, my wife was giving me a cup of her urine, and I was putting a pee sticks inside and checking in many cases with my own eyes, what's happening. And I say, no, this is not a diagnostic. There had to be a better way. That's when we invented Ovul. That's how everything started.
So was it on an already existing company and then you've just been growing it? How did that come together?
So no, I was working on a corporate company as a C-level position, C-level management position, and at home testing, and then I started to build my own company.
So that was your aha moment of this has got to be better. It was from your own personal journey.
Correct. Yeah, it was so much aha moment that I never seen these kind of messy and outdated solutions in my business environment. So never ever. But at home, this was the only way how we did it. And I say no.
Looking back at the early challenges that shaped you the most as a CEO, what did you learn about building a product in a complex health space?
Okay, ask your customers. I think this is the main and best ever. Talk more and more to your customers. Ask your customers how they feel, how they do, why they do this, how this is happening, what's going on. Build fast and ask your customers. When we started Ovul, we have built our prototype in 30 days after we launched the company. So the first prototype was already in the hands of our users in 30 days. What does it mean for us? That we were able to receive a real life response from day one of our company. And I can say this matter a lot. So this is the device we are building, and this is the 30-second version of the hardware device. 30-second, meaning that we were able to get so much valuable information that without it, it would never work. And everything is based on real customer reviews. So it was always egg-shaped, but the first one, customers broke it. The second one was not working properly. The third one was not having a good way to charge it. The fifth one was something else. And we were continuously improving the hardware versions once in 3 weeks. We were just creating the new ones. So first, listen to your customer. The other one, not only listen to your customer, but work with, live with your customer. So many things I would never discover if I would not be present with my customers, how they using our solutions. Not only listening, but okay, so just show me. How do you do this? This changes the whole trajectory of our hardware, at least of our hardware development.
That's cool. So by being with your wife, going through it, you rapidly were able to see what a lot of women's complications would be with it and continue to modify it. And then it gave you more questions to ask your customers so that you got their experience, but you had a platform to start with. For someone who's discovering Ovul for the first time, how do you describe the problem that you solved and what makes your approach different than traditional fertility methods?
Yeah, so we started everything as a fertility tracking device. So now we are more and more into daily hormone tracking. So basically, the whole company changed a little bit since we launched it in 2023. So today is like 1.5, 2 years. We are now matching hormones in saliva and your everyday life. So that's what we do today. And again, speaking to our customers. So first we launched it for basically working on our own fertility struggle and problems with having a kid. And long story short, my kid was born, everything was successful, and Ovul was one of the first devices, like first methods that help us to identify the most fertile days and identify the ovulation. So that's how we built it, and that's how we started. But now, working with a lot of customers, and I think since March to April 2025, I did 197 customer development calls, meaning that I was speaking to 197 women in different stages of life and asking them how Ovul can be valuable for your own healthcare journey. And what we discovered that tracking estrogen, this is the hormone we are tracking with our device, allows to match your daily estrogen fluctuation, symptoms, and the way how you feel yourself and what to do with that. So that's where we are now. Daily estrogen monitoring and insights into body, mind, and nutrition to help you understand your body, to help you understand like how to live your best life. So this is very short what we are doing.
That's amazing because, estrogen dominance is a very high risk factor for women, and we rely on testing that you only do once every 6 months or once every 3 months, and you have no idea between one visit and the next visit and what that blood work is actually saying, and is it registering the correct way. And this is really great. I mean, that's transformative.
Exactly what you're saying now. This is what we discovered during those customer interviews. So we are like, imagine the situation. So I'm always about my own the struggle with having the kids. So I'm about ovulation. I only here. But then talking to real people, real women, real patients, real users. So we ask, okay, so then I knew about this stuff with estrogen dominance. I see this from our users, how they track with Ovul daily saliva testing. So they see that in luteal phase, estrogen goes up, and then they don't know why it is. And like we never understand like what can it be more, like what value can it bring. So then speaking to women, we understand, okay, so wow. So this is huge. So we need to be here more. And this is how we did this.
It's great. As a woman who's in menopause at 55 and constantly trying to figure out, does this hormone therapy that I'm on, does it work, right? You would be a great way for people in my age group that are beyond children that would be like, yippee. That's really neat. So when in women's health and FemTech, the FemTech space, which is where you are, it has evolved rapidly. So what major industry trends or shifts have made the biggest impact on you right now?
This company that we are building could be built because of AI. We use AI a lot. So very first one, so how everything is working, we are tracking chemical changes in saliva with AI image recognition. This is basically a microscope that takes photos of your dried saliva, and then we track specific patterns with our AI layer. Before that, this technology could not exist, like the first one. So we took proven, scientifically validated method, which was already on the market for like 100 years, and enhanced it with AI. The next one is again AI. I'm a great believer in big data. The more users, the more data we have on the one side, so we can match and find the correlations with something else. For example, like a headache or I don't know, like hot flashes or mood swings from one side. So then we see the hormonal trends which are coming from Ovul, and we see what kind of activities you're making as a person. And then we combine all that. So I would say AI is a great game changer in women's health as well, especially for us. This enables so fast execution and value creation. So this is one of the majors one.
You being the first one, do you feel like your competitors are trying to go as quickly as possible to try to catch you?
So I'm not about something like building a company which just because we are first or something. No. For women's health, I would say the other consideration is it was always a taboo, and it is right now. So you don't even, like, I cannot even explain how underrepresented the scientific and clinical research is. So I'm a Siemens guy. I was always about diagnostics, and I know what kind of normal ranges should exist, what are the hormones fluctuating, why, all this stuff. But when I delved into the women's health, I figured that there is no data. Like, basically, you cannot correlate even now exactly when the ovulation is happening, what kind of hormone levels are normal for specific years and ages of the women. So it's just not there. So there are no information like that. So, and what I'm saying that I'm very pro about any other companies doing any activities in women's health and let everything works fine, because the more data we have in general, the more better life we can create.
What geographic area do you serve right now?
We are mainly in the US. I'm a Ukrainian, and we have some activities in Ukraine, and our developers team are there. We have customers in Ukraine, but our main area is United States.
Where do you see your strongest potential for expansion?
So we are the only company in the world who builds a massive data set of dried saliva photos. So no other company have done it before. So we already have more than 20,000 tests done, meaning that with every new photo, we start to see the new correlations, which were never seen before. So meaning that we are sure how the ovulation and estrogen trend tracking works. So saliva changes, then very specific patterns are formed, and the eye tracks them. But what we were not aware of, that we will be able to find the new correlations. For example, stress levels, hydration levels, and many more. Yeah. So basically every morning I get up at like 6:50 a.m. And the first what I do, I check the whole tests done from the last day to see like what's happening. So with every new photo, something new appears, which is like incredible. I don't know. This is a very interesting feeling.
You're right. There's so many variables in there. So when women are tracking it, do you have them fill out a form that says yesterday was a more stressful day, or I didn't drink as much water as I normally would, just to help you kind of learn their life patterns, I guess, right? Because if somebody's habitually not a water drinker, then you know to tell someone who's not habitually a water drinker, water drinking does matter, because this person doesn't experience that. I mean, it's just a constant analysis.
Yeah, so one short story from my past experience. I was finishing the bachelor degree in aviation engines university, and this was a moment when I was able to get a job position at Siemens, one of the affiliated companies. So I was trained in 25 different places on all the world, like in any place you name, there is a Siemens education center over there, and I was there trained as a technician and as application specialist, the guy who understands how the diagnostics works. And then just imagine the picture. I was finishing bachelor degree, coming back and installing the best ever equipment of Siemens in the world, the most progressive diagnostic. And the lab director, she was like, I would say 45 to 50-year-old. I thought that she knew everything about diagnostics more than I do. But she asked me, what are the normal ranges I should use by testing like this specific like hormone? And I say, why are you asking this like me? So it's I should ask you how this works. And then I understood that something is really wrong with diagnostics in general. Meaning that you are totally right, Nikki, that it's personalized. So especially in women's health, something that works for you will never work for somebody else. Like, you need to understand your own normal ranges. You need to understand how your normal day works, like what to expect, how you feel yourself. So that's what we're trying to build with Ovul. Not something like to give you all the answers from, I don't know, from somebody who did it in some other region or somewhere. No, we're providing a tool that allows you to understand your own patterns, to understand what's good for you, what's maybe not the best for you, and change this or not change this. Yeah.
I love that. And that's, I think, a lot of what women even want. They want to know what works for me. Don't put me on a standard protocol that you put everybody on and assume that my chemistry, my body is going to respond that way. That is phenomenal. Huge, good job. From a woman's perspective, good job. What advice would you give to your younger self before becoming a CEO about leadership, product building or trusting your vision?
Just do it. So if you want to do something, do it. And the right moment is now. Like, this is the moment when you should do this. Don't wait for anything else to happen or some, I don't know, like a good culture or a good political environment or business environment. Just, if you want to do this, do this. From the other side, this is a journey. This is not something you can accomplish in 1 year. No, like maybe somebody can, I would say, okay. But you should not expect that. And that's why if you're like starting to build a company, you want to become like an entrepreneur, understand that this will influence how your family, how your friends, everybody. So there is like, you need to understand that this is going to be something that takes a lot of your time. And you need to be prepared for that, same as your family and your close ones.
I like that a lot. I think the younger generation, they're wondering, how do I know what I want to do? How do I know what I want to become? It's like, just start exploring it, get into something, and then learn from it, and then see where it can get better.
The mentors is the best one. So if you already understand, like, what do you want to do, for example, like a healthcare or diagnostics, as in my case, so then you should pick somebody who is highly professional or already has great traction, or somebody who did something, accomplished something, that you can understand that this is like a person I want to be, like I want to understand how they did it, and then just address this person. Maybe not everybody understands this, but everybody is like, especially those kind of persons, they are very reactive, and then they will help. I never heard that I will not help you with the advice,
Right.
or I never heard that, like, I know I'm not sharing this. You just address this person and ask, okay, can I be with you like 1 hour a week? That's it. That's what it takes.
You're doing such a good job. I'm like, you're answering all my questions before I ask them. When you think about the next stage of visibility for Ovul, what types of exposure, partnerships, or audiences would make the biggest difference for growth for you?
Yeah, interesting. So this is what we do every day. And this is why I'm very glad that I have a co-founder, Kate. She drives our awareness and education. In women's health especially, everything is taboo. So in many cases, you cannot tell about it openly, or you cannot speak about something. There are some ranges. Education and awareness, that's what we are trying to do. That's why I'm here on this podcast. I really think that this is basically in women's hands to grow women's health in general, like to bring these tools on the market, to speak about it. We are doing it a lot. So what we are doing, we are a top 200 startups in TechCrunch this year. We are winners of L'Oreal Accelerator. So one of our ideas was that estrogen and hormones in general are very specific to the skin care. Basically, your skin is changing depending on your hormonal levels. And this was the idea. So we can match the skincare routine, which you're doing on a daily basis, with exact hormone levels you're having from Ovul. So we started to explore this stuff. So we are exhibiting this idea. So you can do personalized skincare routines as well, not only for your health and wellness, but also for your skincare. So, I mean, there are many topics here, many like different target audiences. One of audience we also address are the girls, like women in puberty. So with Ovul, we can help identify the first period, like the first menarche, which appeared to be a great topic, like a very big topic for many women in young ages. So I have 3 boys, so I'm not having a lot of experience probably with it, but my co-founders have. So they have like 11, 13 years old kids, and we are now looking into this direction. How can we improve this first period experience, not to face it in school, but you will be maybe ready for that. So that's what we are doing. Looking into many directions. In general, awareness and education is the best we can do.
What metrics or customer feedback have been most helpful in shaping the product, and how do you measure customer satisfaction today?
Amazing question. Yeah, so I'm calling my customers. So I'm just like having a phone conversation with many of them and asking like, how was it? What do we need to add or to change? And the best is customers are telling me what to do. So very last time, I even shared the Figma files of our application, of our next application development. I shared the Figma files, which are the files where we're trying to figure out the new designs and everything with my customers. And I asked them, okay, so you can go into this website, basically like the link, and you can add whatever you would like to have in our app. Just put a proposal there. Just say, okay, so I need this to be on top of this, or I need some specific symptoms, or I want to have, I don't know, like the basal body temperature inside of our app. or just anything else that you think is helpful and necessary for you as a user. So that's why I'm very much into this, I would say. Yeah.
That's fantastic. If you suddenly had a larger marketing budget for one initiative, what would you invest in first and why?
Great question. I'm thinking about the UGC and influencers. Like what I see that now a lot of consumer-based decisions are made after listening to somebody who has at least a great page on Instagram and great experience behind. So this will be our number one priority. So we would partner with influencer like that who understands women's health, who understands the gaps and promoting it already, and we would like to be a partner with such a person.
How do you fulfill right now?
So we are only, right now we're selling only from our website, which is ovul.ai. You can go there, order the device, and right now we have a very interesting offer. We provide unlimited 12 months testing with our device. So you don't have any refills, you just wipe out previous saliva and put a new one inside. That's how the test is done.
Okay.
And the main right now is happening in the application. So the more you test, the more you put inside your data, like your own information, how you feel yourself, what you do, the more personalized insights into your body, mind, and nutrition you will get. So Ovul AI, we have a very interesting offer right now, and you can always contact me on LinkedIn. So whenever you just want to ask something, just put me a message. Yeah.
What growth targets are you working towards internally, and what strategic moves do you see to help you reach them?
So we want to have more users. So right now, as I mentioned before, with every new user, we have new photos, we have new layers of information which we can match, and we can uncover something new which never existed before. So for us, users are the main target right now. So we want to sell like 1,700 devices in the next 6 months. So that's our target goal one. And the target goal two, recently, I think like 10 days ago, the FDA have dismissed the black label notification for estrogen therapy, which means that probably now the estrogen therapy during the perimenopause and menopause will be more accessible and more women will use it. So we are thinking that Ovul is a great tool to catch the high levels of estrogen when it goes too far away. So our strategic move is here to explore this more, to provide more satisfied therapy treatment during the perimenopause and menopause using the hormone replacement therapy. So this is what is our, I would say, a North Star.
You're fantastic. The sky is the limit for you. What you've developed is so needed, and there are so many doctors and treatment facilities. You're helping just a woman be able to understand her own body and her own chemistry and how her environment affects life well-being. And secondly, you're providing amazing information for people trying to help women with their different products and services to be able to have real live information to create things to help them. So if someone wants to go down the natural path to getting better, they can look and see what kinds of herbs they can put into their life and see how it affects them. From exercise, from hydration, from herbal, just not just pharmaceutical, just even going down the natural pathway of how do you do it. I mean, it's just incredible data, incredible data.
Yes, exactly what you say. This is what we are doing, trying to do.
How, from an accuracy standpoint, do you feel like the results that you're getting are incredibly accurate?
Again, the great stuff from this tech that it's already been on the market since 1945. So if you Google ovulation microscope or ovulation saliva test, you will find the FDA page explaining how this is working in general before you use the AI. So everything was available. If you use a microscope and look into your dried saliva, you will be able to find specific patterns that characterize the estrogen changes. What we did here, so we improved that. Because AI is much more, I would say in some categorization, we have 99 point something % of accuracy. So there are many clinical papers published. We've done our own clinical trials, and we received 97.6% accuracy in detecting ovulation comparing to elastics. And again, so we are not doing this on our own. So it's already been there. We proved that it's working and even more accurate because of AI. Yeah.
You know, I track with you 100% because as I've gotten older, they would always do blood work to try to test my hormones. And then my naturopath actually had me do the saliva test. And when we originally did it, I had to wait a whole month to get the results back because I did the saliva test over a 2-day period of time, sent it overseas, and then I had to wait for the results to come back a really long time. This last one that I did, we actually got the results back in like 17 days. In your case, would you have the data almost overnight? Like how fast does that result come back?
Yeah, so this is at home use device. So right now we are wellness only. We don't provide any diagnostics or disease detection, to be clear. So we provide you the estrogen trends, how this is changing. So with this device at home, you use it daily, several times per day even. It needs 43 minutes to provide you a result in the app. So basically what you do is, I'm showing the exact daily testing. You open the device, you take out the previous saliva, like with any piece of cloth or with specific ones that included in the kit, and then you put a new one. You close the device, in 43 minutes you will get result in the app. That's how it is. The most simple test ever. You don't need to do anything with your eyes or, I don't know, to wait for something or to go to the extra privacy. If anybody ever experienced the morning urine testing, so you can do this, and you should do this if you want to, this as we did in our family. But how long can you do this? I don't know. Whenever you missed something, if you missed the first morning tests, then that's it. With Ovul, you can test multiply times per day. Whenever you see basically the device, you take out saliva, put a new one. This is something great about this tech.
Well, congratulations on that, because I mean, you took your aha moment, your own personal thing, and turned it into something that's going to help women worldwide.
I want to say always a lot thanks for support of my wife.
Yes.
She made this possible in general.
I really want to thank you for your time today, because this has been a true pleasure of a conversation. And I wish you every ounce of success with this. I mean, you're going to be successful, but I say just thank you from women to you.
Thank you so much. Yes.
Really amazing. Serhii, thank you for sharing your story, your mission, and your incredible work with what you're doing with Ovul. Your commitment to improving women's health and giving people more clarity and confidence in their fertility journey is truly inspiring. To everyone listening, if you want to learn more about Ovul or connect with Serhii, we'll have all the links in the show notes. Thank you for joining us today. Be sure to subscribe, share this episode with someone who needs it, every woman in your life, and keep exploring what's possible when innovation meets purpose. Until next time.